Picture this, a 8-year-old girl who would hum to herself and dramatically twirl around the hospital corridor. Hi, I'm Preeti Mahendra, the girl who grew above a hospital. Our home was above a hospital. No, I did not grow up in a house, I grew up in a hospital. I would often stroll around, drawing on the walls of the hospital. Much to my father's silent disapproval, I even once drew on his passport pages. My vision here to speak about today is the thought of prevention in healthcare. Here, I've used the word rewriting the purpose of healthcare. There was a lot of conversation with choosing the word rewriting, a conversation with myself. I was often asked in my dreams and when I was thinking, why the word rewriting? Because I want to scrape through everything that people envision about healthcare and rewrite it completely in a preventive format. During COVID-19, when it struck, I was doing my master's in England, and I never asked the question as to how do we cure this. My thought was always, how can we prevent this from reaching us? How can we build systems before it collapses? As the same 8-year-old who would look at patients being pushed in late 2000s, when there were a lot of factory incidents happening, I would see my dad treat patients with a lot of crush injuries, with their limbs and bones being fractured. And even then, my thought was, how are we going to prevent this from happening? From that 8-year-old girl, and now to this 28-year-old woman who's building solutions, here I am talking about prevention. When I had to strip down the thought of prevention completely, I came up with these 8 pointers as to how healthcare can be rewritten and, as we say, the universal blueprint for prevention. The illusion of cure. What I would call the illusion of cure, next one. What I would call the illusion of cure is very simple. The way people look at treatment nowadays is just about how they've been cared in the hospital. That simple statement is illusion of cure. If we were asked, how do we not get to a point where we need to be treated, we would never have an illusion to be treated. We would never have an illusion of cure. Modern medicine has done so much, it has done extraordinary things. We bypass arteries, we replace joints, and we resuscitate broken hearts. But why do we get to a point where we have to do so? We forget about screening and we forget about the fact that all this can be prevented. The awakening through health literacy. What is health literacy? People like us are very few at this point because doctors are practicing, women are into business, women focus on family and children. Nobody talks about how healthcare can be preventive in nature, either at home or at offices. We only focus on improving businesses, getting revenue out of it. But it is important that healthcare advocates, educators, and even doctors take a step back and regain their role as educators. Without healthcare literacy, we will never understand what a pap smear is. A father would never know how to read blood pressure numbers. A teenager would never understand what stress management is. We all need healthcare literacy. Let us go back to a time where there was a doctor in a corner of a village and he knew everything of medicine. He is and he was literate, health literate. Where are such people now? Do I need to come to TEDx to talk about health literacy? We are in 2026, and it is hardly a handful of people, hardly a handful of women who are talking about prevention. I would say none. So let's take a step back and go into preventive medicine. Why is it not a topic that is explored often? Mental health has preventive strength. We often confuse mental health separate from physical health. The jitters that we get, the shivers that goes through our spine, the stress, it is not different from anything that happens to us physically. We often call it butterflies. What we forget is that they are all emotional triggers. They are our brain in sync with our body trying to scream that they need help. If we don't make therapy normal, if we don't make communication normal, if we are sitting at dining tables still speaking about school marks, cards, wedding and business profits and not about how to manage stress, how to take care of family problems, how to stand up and communicate, we are always going to be 2 generations behind irrespective of how older we are. Where instinct becomes an action. Like I said, as I was 8-year-old, when I would see a lot of crush injuries, I could never analyze what my first instinct then was. I did not know the word for it. But now, when I think about it, my first instinct is always prevention. As an 8-year-old, I would still think, how do we prevent this from happening? That is the thought of prevention. That was my first instinct towards this. When we talk about instinct becoming an action, whenever I'm put in a situation where I need to think of anything important in my life, I close my eyes, I sit and I think what is my first instinct. I'm someone who believes in a gut feeling deeply. And when it comes to this, and I was taken the role as a CEO, my first instinct was always prevention. Hence I stand here today to talk about these 8 shifts in healthcare which I formed, which are very essential for healthcare to be envisioned in such a way. Can you go to the next one? The power of early detection. Go back. When we cross the illusion of cure and we awaken through health literacy, we make sure that mental health is a preventive measure. And when instincts become action, what I mean by that is when I stand here today, when my instinct has become an action, we reach to a point where we have the power of early detection. Early detection can save lives, it can reverse diabetes, it can manage hypertension, we can cure cervical cancer completely with early detection. My role today is not just a CEO of a hospital. It is me making sure that every patient that walks in, every person that lives around the society that I live in, and with a stage like this, maybe people all around the world, have the power of early detection. I take this responsibility, which came to me as a thought, to make it a revolution, and I now ask the world to make it a revolution and to take preventive healthcare up more seriously. Architecturing a preventive first model. What if hospitals are built in a different way? What if OPD wards are built in a way when a patient walks in, we have preventive measures spoken about? What if we analyze risks rather than just treating them? If the basic architecture of a hospital, a home, a clinic is structured in a way that when people are walked in, we are building a system for them where they can think about preventive healthcare. Why are we constructing buildings where we only treat patients? Why are we not treating them how to prevent diseases before it gets to them? Let us architecture a preventive measures in order to treat patients. It is only then will they understand the power, and the awareness is only reached to them only when they know that such an architecture is present. It is 2026, and if we really are serious about prevention in healthcare, there is a lot of AI technology that we can use which goes to the molecule level and identifies symptoms and diseases even before it reaches us. Why are we not doing it? Are we really taking this seriously? Why are we only treating people after they reach us? We do a lot of cervical cancer camps at the hospital, and it's very strange how women come up to me and still say, I do not know anything about the vaccine. It was a decade ago almost since I took my first dose. With so much awareness programs going around in the world, how can women still not know about something as basic as a cervical cancer vaccine? Are we not lacking the basic education that we are giving to the people around us? We are only building and we are only architecturing our system in a way that is only treatment. We are not showing them the way aside. We are not showing them the cure. We are not showing them prevention. Policy and system alignment. It is not enough if one person talks about prevention. It is not enough if one government body makes a policy. It is not enough if one doctor goes around speaking about prevention. Every corporate office needs to take a responsibility to incentivize, to prioritize, and to ensure that every official who works in the office is taking preventive measures for their health. How can we reach there? It is only through policy. When a structured policy is made, it is only then people start to realize and take it seriously. Only when governments start incentivize and financially start putting into preventive thoughts as much as they're putting into last stage treatments, are people going to get as serious into prevention. Building a universal blueprint for prevention. Ultimately, after this whole conversation, after making a whole blueprint of how preventive healthcare can be spread through, if we do not incorporate it at homes, you know how we often service our cars, we update our phones, and we sanitize our kitchens. Why are we not thinking about frequent screening? Why does screening have to be a stigma? Why are we not considering the fact that screening is going to help us take care of ourselves? It is important that we build a footprint and we build a universal blueprint for ourselves, be it at home, be it at hospitals, be it at offices. Only when we have a blueprint is when we can follow through with our healthcare. And as I always say, prevention is power. Thank you. Yeah.